What's going on, ladies and gentlemen? Welcome back to the channel. I hope you all are healthy and well. Thank you so much for joining me today. Today, we'll be reacting to healthcare in Germany. Now, I know recently we have been reacting to videos, pertaining to the healthcare system in Germany and personal experiences, personal stories coming from human beings about the healthcare in Germany, their experience, whether they were tourists traveling or, people that live within the country, locals of the country, citizens of the country. The overall experience is amazing. Everyone's experience has been A1, 100%. Nothing positive reviews, should I say. And I really wish we could do something like that in the US, switch it up. What is it going to take? Can't we just bump the taxes up a little bit more or something like that? That way the people are funding it because it will help us out. So wouldn't that really make sense? I don't know, guys. But I really do enjoy seeing how you guys do things in Germany as far as the healthcare system. A lot of other countries really, should I say, intrigue me as far as the healthcare system. Do I ever want to have to experience one day? No. No, because that would mean it's an emergency and I don't want to go through that. But at least I can educate myself and experience it that way. Listen to the stories and everything. Original video link will be down below in the description. Today we'll be reacting to healthcare in Germany. Let's jump right into this. This was highly recommended. It's great having healthcare.
The last international
I ain't
healthcare
going to the
system we
doctor, I'll
covered,
tell you that.
Singapore, got a great response from all of you. This week we head back to Europe. Specifically, we're going to Germany. Their universal healthcare system is based on the principles of Bismarck, which say that the state should provide only for those unable to provide for themselves. It's a private insurance system, and it's the topic of this week's Healthcare Triage. Health insurance is mandatory in Germany. Everyone has to get it. Before 2009, some of the richest people in Germany could choose not to buy insurance, but that's no longer the case. Insurance is sold only by nonprofit private companies. There are more than 130 of them, and they're also known as sickness funds. There's statutory health insurance, or SHI, or voluntary private health insurance, or PHI. PHI covers some of the benefits that SHI doesn't, but most are minor. It also gets you access to some better amenities and covers some co-pays for other services. 86% of Germans are covered by SHI and 11% by PHI. As with other universal systems, the insurance is pretty comprehensive. Coverage includes preventive services, hospitalizations, outpatient visits, prescription drugs, mental health, dental care, eye care, rehab, hospice care, physical therapy, even sick leave is covered. Long-term care is covered by a different insurance, but that's mandatory too. There are limits to this though, and some people buy supplemental private long-term care insurance. Any employed citizens and pensioners who make less than 52,200 euros a year and their dependents are covered by SHI. Anyone who makes more than that or who is self-employed can choose to get the SHI or buy PHI. About 3/4 of people choose the SHI path. There used to be no co-pays for SHI.
Wait. Hey, so hold on real quick. Less than 52 euros a year, and their dependents are covered by SHI. Anyone who makes more than that or who is self-employed can choose to get the SHI. Okay.
About 3/4 of people choose the SHI path. There used to be no co-pays for SHI, but some were added in 2004. They were about 10 euros for a doctor's visit. But in 2013, most of those were removed again. There are still co-pays, 5 to 10 euros for prescriptions, but lots of drugs are still free, 10 euros a day for hospitalizations, and 5 to 10 euros for medical aids. Deductibles can vary by plan. There's no cost sharing at all for kids, and a cap on out-of-pocket payments at 2% of household income. That number is 1% if you have a chronic illness. Out-of-pocket spending accounts for just over 13% of all healthcare spending in Germany, making it slightly less than Canada, comparable to the US, but much more than France. About 72% of healthcare spending is public spending, and just over 57% comes from SHI. Employees or pensioners pay an 8.2% tax on their wages up to 47,250 euros. Wages above that are exempt from the tax. Employers contribute an additional 7.3% tax. The contributions are all put together and then spread out amongst the nonprofit SHI funds. If a fund runs low on money, it can charge the members a bit extra. In 2011, 13 of the 156 funds did so, to the tune of about 100 to 180 euros a year. PHIs are considered private health spending. There were 42 of them in 2011, slightly more than half of them are for-profit. The other slightly less than half are non-profit. The premiums are risk-based on entry into the program, meaning that older and sicker people pay more. Employers make contributions to PHI as they do for SHI, but the employee contribution is higher. PHI is still tightly regulated by the government to protect consumers, though. Laws also encourage competition between the funds. Doctors belong to regional associations, which negotiate contracts with the various sickness funds. Outpatient docs work in private practice, for the most part, with 60% in solo practices, 25% in dual practices, and the rest in group practices. Mid-level practitioners, like physician assistants, are also employed in most offices. About half of physicians in SHI programs are family docs, and about half are specialists. Patients can choose any primary care physician, specialist, or hospital that they like. There's no real gatekeeping mandate, meaning that people can go to see specialists without first getting the permission of their primary care doctor. Although some funds do offer them, and offer incentives for using those gatekeeping functions. A relatively small number of people do, though. Most docs work in a fee-for-service way based on negotiated rates. There are preset maximum numbers of patients per practice, as well as reimbursement points per patient. This means that there are limits on the number of patients and number of treatments for which a doc can be paid each year. If a doctor goes over, they may not be paid. About half of all hospital beds are in nonprofit public hospitals. An additional third are in private nonprofit hands. The rest are for-profit, and that percentage has been growing. Most hospitals salary doctors who don't also work in the outpatient setting. The Federal Joint Committee decides what to cover and how to define quality. The Institute for Applied Quality Improvement and Research in Healthcare is responsible for quality assurance. Hospitals are mandated to report on 27 indicators so that they can be publicly compared. The country tries to control costs in a number of ways. There are a number of voluntary insurance schemes to do better disease management. Germany uses reference pricing with respect to drugs to try to get citizens to choose cheaper options. Basically, that means that the insurance will pay the amount of a cheapest drug in a class, and if patients want a more expensive one, they have to pay the difference themselves. A lot of research goes into deciding which drugs
I understand. I mean, yeah.
are most cost-effective. Finally,
My grandma like that, man. Boy, you could give her something. Grandma, it's free. No, but I like the other one. It's stronger. All right, Grandma. Can she take a higher dosage of this one? Yeah, and it'll work perfectly fine. No, I want the other one. It's stronger. All right.
themselves. A lot of research goes into deciding which drugs are most cost-effective. Finally, regional budgets are used to hold down spending. For instance, if a doctor goes over what's expected for prescriptions for their patients, they are held financially liable. In 2011, Germany...
But how? How? Oh, because you're like going over a budget type of thing? Wait.
themselves. A lot of research.
So, like, this basically forces the doctor, basically. It keeps everything in order. You know, because there's a lot of schemes going on in the U.S., and I don't know if I'm going off topic, if this, like, can relate, but there's a lot of schemes in the U.S. where the doctors prescribe, patients certain things that they don't need. Like, under the table, on the low or something like that for some side money or something. Or they prescribe them too much of something because somebody's begging, or too frequently because that person keeps coming back. Oh, I need it. My neck, my back, my ear. All that type of BS, So this kind of puts like a limit to it. So it's like, hey, can't. You know what I'm saying? We are educated. You will be perfectly fine from this dosage, this amount. We won't see you again for another year. Bye-bye. You know what I'm saying? Stuff like that. And if they do, well, you got to pay the price. Now you got to pay for it. And you don't want to do that.
And if patients want a more expensive one, they have to pay the difference themselves to try to get citizens to choose cheaper options. Basically, that means that the insurance will pay the amount of a cheapest drug in a class. And if patients want a more expensive one, they have to pay the difference themselves. A lot of research goes into deciding which drugs are most cost-effective. Finally, regional budgets are used to hold down spending. For instance, if a doctor goes over what's expected for prescriptions for their patients, they are held financially liable. In 2011, Germany spent $4,495 per capita on healthcare, or about 11.3% of GDP. That puts it on par with France. It's expensive, except for the US, which is insane at $8,508 per capita and 17.7% of GDP. But unlike some other countries, Germans have great access. More than 3/4 of Germans are able to get same-day or next-day appointments with their doctor, putting them at or near the top of the developed world.
Nice.
Quality is generally good. Life expectancy at birth is 81 years, making them 24th in the world. That's behind
Yo, bro,
Singapore
what's
at
up?
84.
Why we in the 70s? Why we the only one of the 70s? Why everybody in the 80s and up? Everybody in the 80, 84? Damn. 81, 82, 81, 84? They 84.5 though. They basically like 85. They really like 85. What? 80, 81? I wonder what. Oh, yeah, that's the UK. Okay. What is it in Australia? I wonder what it is in Australia. New Zealand, though. Okay. Interesting. What?
Their doctor, putting them at or near the top of the developed world. Quality is generally good. Life expectancy at birth is 81 years, making them 24th in the world. That's behind Singapore at 84, Canada at 82.5, and France at 82.3, but ahead of the UK at 81 and the US at 79.8. In infant mortality, it beats most, if not all, of those countries. Germany has an above average number of physicians and nurses. They have a below average number of CT and MRI scanners. Their preventable mortality rates are well below OECD average. A 2012 study found that Germany outperforms the United States and sometimes the UK in preventing death. It loses to France, though. Downsides? Because doctors are spread out so much, there can be gaps in knowledge about what patients have and what's been done. Surprisingly for Germans, it's somewhat inefficient. The fee-for-service model encourages more care, which some think goes too far. And some doctors hate the system, which can penalize them for doing too much. Germans worry that differences in physician salaries may lead to a primary care shortage in the future. Self-employed people also pay a lot for care since they're...
That's probably why we're in debt though as a country, because, you know, a lot of doctors want to do so much as well, but then you're held accountable for these prescriptions, you know? And if not, then you're losing and you're missing out. They're losing the stuff out of stock. They're paying for it, not making the money back. That will draw you into debt eventually. Doesn't matter how little the amount is. So this is gonna put that limit, and even if they want to, do more for that patient, continue to give them more antibiotics and medicine, this and that, they can't. They can't. So I'm pretty sure they're going to be prescribed with the right amount of dosage, a good capacity of whatever it is, and they will be perfectly fine. That way, the patient doesn't have an excuse to come back or to try to take advantage or this or that, Because you also got to make sure that people are safe and good as well. We got people that will take advantage of the situation. Free healthcare. We got people that will go to the doctor and act like their whole body finna fall apart and then talk about some doc. Maybe you just, we'll leave me cannabis. Man, just go home, bro. Stop playing with me, bro. Stop playing. Go home, bro. You know what I'm saying? Like, I'm on to you. I'm on to you. I'm on to y'all, bro. I'm on to y'all, bro. They want to supply with a little something so that they hurting. They hurting. Go get a little massage then. Go take a bath. Go take a warm bath, a warm shower. Go put some icy hot on. Take some vitamin B, mineral something. Don't make no sense. For real. So, yo, bro, so many Americans I know would take advantage of this healthcare system. They wouldn't even go because they sick. They would create so many lies to get so many certain things, and then I'm looking at the other people in the U.S. that are hustlers. They dealing and stuff. They're gonna use that to their advantage and get some free stuff and sell it. It's just gonna be a lot of stuff. It's gonna be a lot of stuff up to no good. That's the way I'm thinking about it. Because those prescriptions are good. They are put to a use. They are made for a use for something specifically that's going on with you. So when you get to put it in your body, you got that going on with you. What do? You taking drugs now. I said you just take a drug. Yo, is that why you think the U.S. don't got that type of healthcare system? Did we just uncrack the case? Is that why? Because you know we got issues with a lot of stuff, and we got a lot of unfortunate situations, should I say, and things going on in the U.S. as far as like drugs and narcotics and stuff. So you think that's like one of the things they try to eliminate? We can't give them easy access, but even though there are some people who go to the doctor and get easy access, Talk about then, Oh yeah, doctor gave it to me. How? Are you okay? You good? Yeah. Like you lying. They write you a prescription. It's that easy, bro.
Of physicians and nurses. They have a below average number of CT and MRI scanners. Their preventable mortality rates are well below OECD average. A 2012 study found that Germany outperforms the United States and sometimes the UK in preventing death. It loses to France though. Downsides? Because doctors are spread out so much, there can be gaps in knowledge about what patients have and what's been done. Surprisingly for Germans, it's somewhat inefficient. The fee-for-service model encourages more care, which some think goes too far. And some doctors hate the system, which can penalize them for doing too much. Germans worry that differences in physician salaries may lead to a primary care shortage in the future. Self-employed people also pay a lot. Doctors hate the system, which can penalize them for doing too much. Germans worry that differences in physician salaries may lead to a primary care shortage in the future. Self-employed people also pay a lot for care since they're responsible both for the employer and employee contribution. Finally, some claim that systems that employ tiers of coverage, specifically the SHI and the PHI, often lead to the wealthy doing much better than the not wealthy. But it's worth noting that the vast majority of people choose the SHI option. What keeps the public and the private option so close in terms of quality, costs, and benefits? Likely it's the German government, and there's a lot to be said for it.
Man, this was an amazing video. This video seemed like it was... That's me running my mouth. 16 minutes. We about to hit 17 minutes. This video was 7 minutes. Well, that's actually good. That's actually good, because I don't like, giving y'all crazy long videos, though. Sometimes I be over talking. Please let me know in the comments. How did you feel about this video? Feel free to include your honest thoughts and opinions. Educate me. Educate us in the comments down below, please. A little bit more about the healthcare system in Germany, but well, I don't want to put it that way, but could you please explain it in a more, is simplistic a word? Is simplistic a word? It's simple. I was gonna say, could you please explain it in a more simplistic way? If that's not a word, I'm putting it in the dictionary. I'm putting it in the dictionary. Simplistic. You better tell me this is a word. Treating complex issues and problems as if they were much simpler than they really are. Okay. I mean, yeah. Yo, I just been pulling like words out of my mind lately that I've never said before. And like, it's just added to my vocabulary. Does that happen to you guys? Like lately, I've just been saying new words and then I'll be like, is that a word? Like, wow. Wow. But please, could you explain it in a more simple way, for everyone, worldwide, everyone around the world? Please feel free to give a brief explanation. That's something that everyone can understand, I come to realize that I have a lot of young people watching my videos as well, and I want them to be able to understand as well. This video was amazing, but I feel like this video right here may lose some people who aren't too familiar with Germany's healthcare system, because I've been familiar, but I wanted like a more stricter updated version, and this was highly recommended. But there are some other videos out there that explain it in a more, easy to understand manner, should I say, because this was definitely hard to pick up when I was learning. I'm like, wait, what? I was trying to learn the differences and how it was going and everything. But please, check out my other reactions pertaining to Germany's healthcare system. I got some wonderful supporters, so I know you guys will include whatever you feel, whatever you feel you need to in the comments down below. We don't do no bashing or judging people, so feel free to ask some questions in the comments. I always got a million questions. Feel free to follow my Twitch. Subscribe to all my other YouTube channels, guys. To all my other YouTube channels. And we will be going live this Friday on Twitch, and I'm going to explain why we ain't been going live. We're going live on Twitch this Friday. We're going live on Twitch. Stay tuned. I love you all so much. Thank you for joining me today to react to healthcare in Germany. Feel free to share your honest and your honest true stories, experiences, whether you were a tourist, a traveler, or a citizen of Germany. What was it like? What was it like? I want to hear some stories as well. I really love reading the comments and hearing everybody's stories and the way you guys break things down, because there may be something that was said in this video that, I understood, but maybe you'll give me a better explanation, should I say, This was an amazing video, but you might be able to break it down even more for me, Seriously. I love you guys so much. Stay safe, and I hope to catch you all in the next reaction video. This was a great video. Thank you for all the recommendations. This video included more than the previous ones I actually checked out. They were more so personal experiences. We haven't really checked out a strict video pertaining to Germany's healthcare like this one. Original video link will be down below in the description as well. Did I like the video? I did like the video. Stay safe, and I'll catch you all in the next reaction video.